Welcome back to our series Ask Dr. Paresh Doshi. This is our 7th episode, and in this episode I will be discussing about a question which I am very frequently asked: what is the success rate of deep brain stimulation surgery or DBS surgery? Many patients have asked me, "Sir, we are ready to undergo deep brain stimulation surgery, but we are not sure how successful this surgery will be." Now, this is a very tricky question because as a doctor, if I tell you that it is 100% successful, that is also wrong. If I tell you 80% successful, then you will go away and not get operated. The reason is lack of information. So what is the lack of information that I'm talking about? The lack of information is about properly getting connected to the doctor and understanding what to expect out of DBS surgery. Let me explain you this in a little more detail. Patients of Parkinson's disease after deep brain stimulation surgery can get a fantastic control of their Parkinson's disease. Before surgery, most of these patients have several of these problems or some of these problems. Which are these problems? Motor fluctuation, sudden on, sudden off. Sometimes the medical effect comes, sometimes the medical effect doesn't come. Sometimes the medicine effect comes for 2 hours, sometimes it lasts for 4 hours. And you are never sure on a what particular day how the medicines are going to behave. This is called motor fluctuation. Second is dyskinesia, involuntary movements. So these are the side effect of medicines. Excessive dose of medicines can cause dyskinesia, and because of that and this kind of involuntary movement, the patients either have difficulty in walking or social embarrassment because they don't want to go out because people will ask why your hand is moving like that. So because of this, they usually remain homebound. And the third is hallucinations. Patients start suffering from hallucinations because of long-standing levodopa treatment or a dopaminergic drugs treatment. Hallucination sets in, and there are many other reasons for undergoing DBS surgery. So how does the deep brain stimulation surgery help you? If you know this, then you would be able to judge whether it is successful or not. So let me tell you, the DBS surgery can remove all these 3 problems. It can remove your motor fluctuations, it can remove your dyskinesia, and also it can reduce your hallucinations. Why? Because we are going to reduce the medications after DBS surgery. So if this is what you are looking for, you will define this as 100% successful. However, it is important for you to know and learn that you will not be normal. You will not go back to pre-disease state. You would be better controlled disease, you would have a better quality of life, your activities of daily living will become independent. If you are not able to go out, you will be able to go out. If you are not going to office, you will be able to go to office. If you are not seeking promotion, you will take the promotion and go to the next level with more confidence. So this is how the DBS helps. Now the success of the DBS is also dependent on 2 important aspects. One aspect is about the technique and equipment. If you have the best experienced doctor who has performed large number of surgeries and having all the DBS related equipment in the hospital, not being borrowed from the device companies, that is something that you should always inquire before undergoing DBS at any center. That do you have a stereotactic frame? Do you have a microelectrode recording instruments? Do you have intraoperative neurophysiological monitoring or assessment tools? If they do not have it, do not undergo DBS at that center. If the doctor is experienced, he is expert, he has experience of more than 300, 400 surgeries, and his center has all this equipment, then it is likely that your DBS surgery will be successful. Second important aspect is you ask the doctor as to how many years he has been working in that particular hospital. Doctors have a habit of joining one hospital to other hospital to the third hospital, and you can understand that when I jump from one place to the other place, I have to set up the whole setup again. Unless the doctor with whom you are undergoing surgery has been working in a particular hospital consistently for more than 10 to 15 years, then only you should trust him to do the DBS surgery. Second important aspect is programming, because DBS surgery outcome is as good as the knowledge of DBS programming, because this pacemaker has to be programmed. If you do not know how to program this pacemaker, then you cannot get any benefit out of this. There are millions of combinations in this pacemaker which have to be explored. And I come across many patients who have gone across DBS surgery and they tell us, Doctor, we have been called for programming every 2 months, every 1 month. We must have gone in last 1 year 12 times, 15 times. How many times do you call for programming? At Jaslok Hospital, our programming protocol is pretty standard. We program most of the patients after surgery in the first 10 to 12 days. After that, 30% of our patients are expected to come within the first 3 months for a repeat programming. After that, we don't see the patient. Usually, we see them once a year or maybe once in 2 years. If you know how to program, then you do not have to experiment with the patients. You do not have to call patients 15 times to set up the program. The reason for calling 10 to 12 times is only one. You don't know your job. And that is why you are experimenting with the patient, and that is what you are doing. So these are the things that you should inquire at any center before undergoing deep brain stimulation surgery.